Greetings, patients. It's Dr. Chad Rolland again, back with another topic. Today we're talking about fever and what to do with it. Now, as a chiropractor, I don't directly treat fever, but I have patients who have fevers, and I've learned some things about that from a natural point of view to help support their body during that process. As you know, fever is your body's way of dealing with a problem, usually a microbial infection of some sort, although there are other reasons to have a fever. So keep that in mind as you're going through the process or thinking about it. Fever tells you something that's off. But here's one of the things that we don't think about sometimes is that fever tells your body to go faster, to get into action. It activates your immune system and gets your body underway to attack whatever's going on. The second thing, of course, we might imagine is that fever produces a harsher environment for those micropathogens, that some of them do not have much heat tolerance. Now, fever is generally self-limiting, but it does need to be monitored. As you know, children, or you may not know, but children can generally tolerate a higher fever. That's why they might spike it up, why their body is quicker to react and better able to tolerate it. But of course, consult with your medical doctor because fever can create problems if it's too high. Now, how high is too high? I'm going to give you a link to a medical doctor that has a very nice overview from a scientific and a medical point of view about fever and the therapeutic benefits of it. So you don't have to take my word for it. I'll give that link to you at the end. I think you'll find it pretty interesting. Now, one of the other things to think about is that science has shown that heat shock proteins, which are in our body, decline as we age. Now, a study showed that in young men, heat shock proteins increased by 50% after 30 minutes in a 165-degree sauna. Those heat shock proteins lasted for 48 hours. So one 30-minute episode in a sauna increased the heat shock proteins by 50%, and they lasted for 48 hours. Well, what do those do? Those heat shock protein, and there's one named heat shock protein 70, it increased by 50% per degree Celsius in lung tissue. Those heat shock proteins, again, in our body, and here's one specifically in lung tissue, by every degree Celsius that you went up, it inhibited influenza A, which is a viral infection, and replication of activated innate immune cells like dendritic cells and natural killer cells. So your heat shock proteins, and you can look up the function of them, are an important component to our body's immune system and how it reacts. And having that heat is part of how they are activated. As you have a fever, a lot of times people will say, well, what can I do? It doesn't make you feel real well. And what can I do to reduce that fever? So people will take Tylenol, which is acetaminophen. It's not an anti-inflammatory, but it does reduce pain and it does help reduce fever. They'll also take an NSAID, which would be aspirin, ibuprofen, or naproxen, and that also helps reduce fever and pain, but it's also an anti-inflammatory. So sometimes from a chiropractic point of view, I'll have patients come in who might be taking one of those medications for aches and pains from joints or working too hard in the yard or something like that. Now, I don't advocate those, I don't prescribe medication, but they might be on that. Now, what's one of the problems with being on one of those pain relievers? One of the problems is if you are taking it for pain, it might be masking a low-grade fever. So during the 2020 pandemic, they were telling patients or employees, or in this case, the one person I had heard it from in the military, they were doing temperature checks when they came into their place of employment, and they advised or told their people, do not take pain relievers such as Tylenol or NSAIDs, because it will mask low fever that your body is trying to deal with, and we want to know if you have any level of fever, even if it's a mild fever. So that was an interesting point of view, that we need to be aware of that. Now, going back, when we have a fever, one of the functions that it does is it activates a process that pulls calcium out of your bones if you don't have enough already in the blood or the soft tissues. Now, why would it take it out of the bones? Because that's a storehouse for a number of different minerals in our body. So a fever helps pull calcium out of those hard tissues. And if you know somebody who's had a bad illness and they were in poor health, then you'll see that they might have discoloration of their teeth, or maybe they had another problem with their bones because they didn't have enough calcium. So what can we do to offset that? Well, first of all, what does the calcium do? The calcium is used by the phagocytic white blood cells and macrophages to help strengthen and perform their function of going to eat up those microbes. So keep that in mind when you're having a fever. I want to give calcium. I'll use a calcium. Here's a good quality calcium called multi-source CalMag. It has calcium citrate, and then another good form is calcium lactate. By giving that every half hour or every hour in small doses, it helps to provide the body with the calcium so that it doesn't need to sacrifice the bones during the fever, and it can still feed the macrophages. Other vitamins that I would want to give would be vitamin A, vitamin D, vitamin F, which we talked about helps move the calcium from your body into the tissues. Another form of calcium would be something like this. This is a liquid version of calcium, and it also happens to have magnesium and vitamin D in it. I like this particularly for children. It's more easy to absorb usually than something that's in a tablet form. But having that calcium is something that I can give in small doses throughout the course of the illness to help the immune system do its job better. Does it fix the problem? No, but it helps the immune system work better. Another herbal formula to think about would be to use something that has andrographis in it. Andrographis in this particular complex formula has also holy basil and echinacea, but echinacea and andrographis also help support the body during its time of having a fever. The link I was going to tell you about as we wrap up this video is by a medical doctor from the UK called Dr. John Campbell, Campbell, and you can find several of his videos on YouTube. He's got a couple very good ones, and one would be called Fever the Evidence, or Reducing Fever, Good or Bad. Another title, Reducing Fever Part 2, which was a follow-up. And I also like one he had called Fever the Evidence Base. Very nice overview. I suggest you watch a few of those videos to get a comfortable level with how to deal with fever and its benefits from a natural point of view for dealing with different types of health problems. As always, I don't know your personal condition, so you need to talk about this or other problems with your medical doctor unless you contact me and we have a personal relationship. This information is reliable and accurate to the best of my knowledge. It is for educational purposes and not medical advice. If you're interested in a program or want to contact our office, you can reach us at 814-734-5000 or Rolland with 2Ls health.com on the internet. I look forward to talking to you. Until next time, this is Dr. Chad Rolland wishing you the best of health and happiness.